want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks.
As official United States coronavirus cases surpass 190,000 and 4,000 deaths, with yesterday having seen the largest single jump in coronavirus cases at 26,400, we're really starting to see White House, Congress, and basically everyone really change their tune when it regards this virus. Yesterday, we just saw for the first time the White House giving official projection numbers for how they think this thing is going to unfold, officially projecting that there's going to be between 100,000 and 240,000 deaths. Now, they were very clear to say that this is an estimation which we expect to see, but that we will not accept it, and that they are doing basically everything that they can in order to flatten that curve and see that number go down. But these are the official projections coming out of the White House now. You just saw Donald Trump saying that this is going to be a very tough 2 weeks. So, we're really looking at a situation where things are changing very, very rapidly. And we are in a situation now where Congress is going to have essentially infinite political capital to do what they want. I think in the next couple days, we're really going to see the true faces of a lot of these politicians come out, because the thing that they always tell us is, well, we don't have the political capital. We don't have the ability to pass these things. Well, now we're coming to a situation where everyone is going to know someone who was either killed or, seriously hospitalized from this coronavirus case. I just saw a post on my Facebook feed, terribly sad. Apparently, one of my teachers from middle school just passed away from coronavirus yesterday. So I think we are looking at a situation where everyone is going to know someone who, again, was either hospitalized or died from coronavirus. And, again, that's going to lead to a situation of infinite political capital. Well, in this situation, we're also starting to see a lot of the holes in our hospital and healthcare system really come through. This report out now that hospitals are now telling doctors that they will be fired if they come forward talking about lacking supplies or lacking medical gear. In fact, it's not just a threat. If you actually go through and read the article, let me make it bigger for you. They have already done this. Ming Lin, an emergency room physician in Washington State, said he was told Friday that he was out of a job, quote, because he gave an interview to a newspaper about a Facebook post dealing with what he believed to be inadequate protective gear and testing. And in Chicago, a nurse was fired after emailing colleagues that she wanted to wear more protective masks while on duty. We're really starting to see a situation now where our entire healthcare system seems to be falling apart, and we're seeing instances of lack of gear because of course so many of our gear, so many of our supplies all came from China, and we don't really have the ability to quickly manufacture them. Now, some of that stuff is really changing. We're starting to see companies starting to really get on board, and we saw Donald Trump invoking the Defense Production Act for the first time, although in my opinion more limited than it should have been. But we are starting to see things change up. We're starting to see production ramp up. The USS Comfort arrived in New York City, I believe, 2 days ago. And so we are starting to see, some things changing, but unfortunately, things are not changing fast enough. And where it regards masks and medical gear, one of the more recent changes and recommendations, which we saw, the CDC is officially now admitting that it would be good if individuals sort of in public were wearing masks, but we're kind of in a situation, if I'm being honest with you guys, where we don't have enough masks for hospitals. And so, it's hard to say, well, okay, should average people just, walking and going to the grocery store wear masks, even if that might have helped? I mean, one of the biggest correlations, there was an interesting study which came out, one of the biggest correlations between, countries which dealt with coronavirus successfully and those that didn't, was a big sort of culture of wearing masks. And so people, when they found out that this pandemic was sweeping through, just started wearing masks, and that seemed to be something which really kept down transmission. We saw initially the CDC was telling people basically we didn't need to wear masks and that they should all be allocated to hospitals. Whatever you think about that final decision, it does seem like, the sort of official recommendation does seem to be, sort of shifting around. But again, going back to this instance of hospitals, firing people for speaking out, I think that it does go to a, I guess one of the talking points which we always hear is that China is this great authoritarian country. Well, it turns out that also our workplaces are big authoritarian places as well, because we have so many private hospitals. And the reason, by the way, if you actually go through and read the articles and really look into it, the reason why many of these hospitals are upset about, doctors coming forward and talking about, lacking of supply is because they think that it'll ruin their reputation. But guys, the simple fact is that we need doctors to come forward and talk about lack of supplies so that people can donate, people can, give resources, and we can, try to figure out where the resources need to go. If we have a whole bunch of hospitals not willing to admit that they have, inadequate supply and, in various shortages, then the resources are not going to be properly allocated and properly sourced out. So, I mean, one of the big debates which we've been having right now on the left, I'm going to get to a video about this later, where Brianna Joy Gray was attacked because she came forward against Kamala Harris, saying that she thought that, Medicare for all was, basically everybody should have health care in any situation, not just during COVID-19. But one of the big debates which we've been having right now on the left is whether or not it's a good idea to implement Medicare for all, and how Medicare for all would have, sort of impacted and assisted during this coronavirus situation. Well, guys, if I'm being honest with you, look, I mean, I've talked on this channel how Medicare for all is would clearly be a huge improvement over our current system when dealing with this coronavirus pandemic. I mean, we just saw 3.3 million people filing for uninsurance in a week, like something like a tenfold increase over what you might expect. I think it was actually much more than that, but it was, basically a massive increase, more than anything we've ever seen, significantly over, the Great Recession. I mean, we're talking Great Depression levels of unemployment. There's a projection that we're likely to see 30% unemployment, with so many people losing their insurance literally in the middle of a pandemic. Medicare for all would be able to fix so many of these situations. But also, guys, if I'm being entirely honest with you, this is actually a situation where, while Medicare for all would help because they could, the government could put in place restrictions to say that if you're trying to cover up, suppress workers' ability to speak out because you're concerned with your reputation, they could put restrictions and put controls on that and make it better. For sure, it could definitely help. But actually, this is actually a situation where possibly having a kind of an NHS style, where even hospitals are not private, could assist, might be a better solution to this particular problem than would be Medicare for all. Again, obviously, Medicare for all would go a long way towards improving this situation. But I mean, we really are. What I'm trying to say to you guys is, this is really a massive test of everyone's political ideologies, of, not just neoliberals, who in the past couple weeks, I think, actually just in the past week, I think we've seen most of neoliberal ideology being essentially refuted. But I think just about everyone is having their ideologies, our political worldviews, tested at this point. I mean, this is, follow the data, guys, look closely, and, see how your worldview would have assisted or not assisted in a particular situation, because I think that all of our worldviews are being challenged right now. Every single one of our opinions, our views, are up for debate at this point. So I think that's, if anything comes out of this, hopefully we can see some serious reform. So anyway, I just wanted to sort of quickly talk about that, update you guys on the state of the U.S. Coronavirus crisis and how things are going. So anyway, if you like the video, I'd really appreciate it if you hit the like button and consider subscribing. Thanks.